medical debt is real debt. Most people are working at 8 to 4 and 9 to 5. Most doctors' offices are 8 to 4 and 9 to 5. When are they supposed to see the doctor? We know about medical racism. Medicine, the foundation of medicine was built on racism. The foundation of it, right? Like we don't have to sugarcoat it. We don't have to act like that's not. Look, the foundation of medicine is built on racism, right? And as a healthcare provider, especially as a Black healthcare provider, like I have to acknowledge that. All right, so I think again, we have to give our scenarios, right? You skip your appointment, 6 months later, you're having emergency surgery. You delay getting your blood work done. 3 months later, you're now in my ICU. You avoid taking medications that you've been properly prescribed. And now, not only you're in the hospital, but because of all of the medical bills from being in the hospital, not going to work, now you're talking about bankruptcy, right? This is the consequence and the results that happen when people continue to avoid going to the doctor. Right, I'm your truly Dr. Barry Pierre, board certified internist, host of Medicine Mondays, the author of Your Health, Your Choice, Your Future. And today we got to talk about why people keep avoiding seeing the doctor. But more importantly, we got to talk about it in an act of consequence, right? Because I think a lot of times when people say, you know what, I'm not going to go to the doctor. I'm okay. I feel fine. Y'all know I hate that word. I feel fine. They never talk about the consequences of not doing it. And in medicine, especially, I'm a hospitalist physician. In hospital medicine, we continually see the consequences of not taking action. And more importantly, the action that a lot of y'all are not taking is going to see the doctor, right? And going to get that checkup, doing that blood work, following, the directions that we were prescribed, right? Like it's like a point A to point B. It happens so often and people continue to be shocked when it does, right? So we're going to talk about like what that means, right? Like, as a hospital physician, I see it all the time, y'all. I wish I didn't see it all the time, and I tell people all the time, especially for my patients who they get like a stroke or something happens. And I can point to the fact that, man, if someone would have given you a $4 prescription medication, $4 a month, sometimes free, depending on the pharmacy. If someone would have given you that prescription, you would not be here. Like I can point to it. Like it's, I don't have to think about it. I don't have to like go through all of these twist and turn scenarios. No. If someone would have prescribed you a medication for your blood pressure, you would not be in my hospital with a stroke, right? You'd be able to move the right side of your body, right? Like, yeah, and I get very poignant with that, right? And it's because it is what it is, right? Especially when you have people who will act as if like avoiding seeing the doctor comes with no consequences and it's up to them. It's up to their personal responsibility. Nah, that's not it. Right. So we're going to talk about some things that I think serve as barriers for why people don't come to see the doctor when they need to go see a doctor. Number one, cost. Number two, time. Right. We're going to talk about that. Right. Number three, and this is a big one for me, right? This is why I started my channel, right? Medical trauma / medical distrust, right? A lot of y'all just don't trust our system, right? Y'all don't trust us, right? Y'all don't trust the white collar, right? And because of that, y'all just avoid us. 4 is fear. A lot of y'all, especially for my men, a lot of y'all are just scary. You're just fearful of what it would take to come see us, right? Because you don't know what's going to happen, right? Because there's this mystery, like, oh my God, I'm going to tell you, you have all these issues that you come see us. No, that's not the case. And then 5, right? And this is, I think, a big one, right? The system, right? And you may be like surprised, say, man, what do you mean the system? Like, yes, the system of healthcare adds to the reasons why you don't like coming to see us, and then turn around and blames you for not coming to see us. Think about that. The system adds to the reason why y'all don't go see the doctor, and then turns around and blames you and says it's your fault for not going to see the doctor. These are some numbers, right? Y'all know I love numbers. 32% people avoid a doctor even when they are sick. 32% of people do that. 1 in 3 can't even afford the doctor's visit. 1 in 3 can't even, again, that's a system issue, can't even afford to see the doctor if they wanted to. 56% of y'all feel rushed when you get to the doctor's visit, right? So imagine, right, you're one of the 2 out of 3 who say, you know what, I can afford this doctor visit, right? You're in that group of 68% of people who says, you know what, I'm sick, I'm gonna go see the doctor. And over half of y'all feel rushed to get out the door when you get there. And the big thing issue, right, is that medical debt is a big cause of bankruptcy. And a lot of y'all seem to know that. A lot of y'all seem to know that medical debt is a big cause for bankruptcy. It's one of the reasons why, I don't know if you realize it, but one of the reasons why, shout out to President Biden, right, where he made it so that medical bills couldn't even be on your credit report, right? Because so many people were getting medical bills and then having bad credit because they couldn't afford the medical bills, right? Again, that's a system issue. The system issue. So not only were, if you had, a bad time, right? You got sick, you end up in the hospital, you got all of these bills. It was now affecting whether you can get a house, whether you can get a loan, whether you can get a car. It was affecting all of these different things here because you couldn't, protect yourself when it comes to doing your health, right? So I think it's extremely important, right? I think it's extremely, extremely important, right? When we think about this, right? So y'all know me, right? I talk about this in my book, right? Where quite often I'm running into families who have to decide, right? They literally have to decide, like, should I go to the doctor or not, right? Because they have to decide, can I afford to do so? They have to decide if I can't afford to do so, and then something is wrong, because in their mind, they think something is wrong. Can I afford it? Imagine there are people here who have to ask themselves, can I afford something to be wrong? And for a lot of people, if they say, no, I can't afford for something to be wrong, what do you think they do? They just avoid it, right? They say, hey, you know what? I can't even afford to have a problem right now, so I'm not going to have the problem right now. I'm just act like it's willy-nilly, right? A lot of people are in this case here, right? Extremely, extremely important to understand. Like I said, I've taken care of patients who unfortunately wait to the last minute. They don't wait to the last minute because they wanted to, right? They waited last minute because they had to, right? They couldn't afford it, right? There's some people who, when especially in the hospital setting, where they can't even afford their medications, right? That would keep them out of the hospital. So for them, it's easier for them to just go back to the hospital. Like, hey, I can't even, like, I know you want me to take care of my COPD, but guess what? Those COPD medications cost me like $250 a month, right? I can't afford that, right? And if I can't afford it, guess what? Right? I'm gonna just come back to the hospital. Y'all gonna take care of it, and then y'all can send me a bill. But like, I can't afford it, right? This is a problem at hand when we think about medicine, right? Like, there's a lot of different barriers that are in front of us that add to the factor, right? And one thing I want to make sure that is not a barrier, that you are following this channel, following the series, right? Medicine Mondays, Real Physician Reacts, everything we do on this channel here, right? So make sure you are subscribed to the channel. Right? Y'all already know I was going to do this, right? Make sure you're subscribed to the channel, hit the notification bell, leave us a comment. Let me know what you think about this episode here, right? Like, again, I like, because again, y'all are checking in, right? Y'all are hitting the subscribe button. I love y'all. Y'all are hitting the notification bell. Love y'all for that. But y'all not leaving those comments, right? Y'all got to do all 3 for me, right? Just even if it's one of those, like, first, y'all used to do, like, I don't know if they still do it, where people are like first, just so people can know they were first to the comment. Like, do that. So let's go through the barriers, right? Let's go through the barriers of care that is affecting so many people from coming to see me or people like me in the office. Number one, we talked about this, right? Cost, right? We have to focus on the cost, right? Medical debt is real debt, right? So one, you have to acknowledge, like, especially as a healthcare provider, I have to acknowledge that cost is a real issue, right? When I'm trying to take care of my patients. My patients may not be able to afford to come see me and then come see me for the follow-up, where I talk to them for like 2 minutes to tell them about blood work that was normal. And then I send them on their way, right? Because guess what they had to do? They had to pay the copay, right? They probably had to pay the copay to get the lab work done or testing done. They had to pay the copay to come see me again. They had to not go to work, right? So they were losing money, right? Then they had to pay their, like, come on. Right? Like, cost is a real issue, right? And again, that's why I'm big on telehealth. That's why I'm big on these community centers. Shout out to the self-care direct to consumer things like HIMSS and concierge medicine, direct primary care medicine, right? All these things here are to try to help reduce the cost for you, right? And then y'all know me, I'm big on these health fairs that are always going around, because you'd be surprised what you can get at these health fairs. You can get your blood pressure, you can get cholesterol, you can get your sugar, you can get a lot of tests done at these free health clinics, right? Please take advantage of it from a cost perspective, right? So number 2, right? Time, right? Time is a big issue, right? Most people don't got time. Right, I can assure you, most people don't have the time, right, to take care of themselves, right? So you have to be very mindful, especially as a healthcare provider, right, and recognizing that, yes, you know what? My patient doesn't have the time for me to be lollygagging. My patient doesn't have the time to be waiting in 30 minutes, an hour past their scheduled appointment, right? My patient doesn't have that time, right? Like they got to work, right? They can't take off of work. Right. So again, this is where, like, again, as a healthcare provider, even though it may sound bad for my healthcare providers, because I know y'all like got money, right? I like my money too, right? But like, you got to make sure you're bundling your screening exams, right? That's why we talk about the annual health visit, right? That we try to squeeze everything in that one visit, right? Because we don't want our patients to have to come multiple times over and over and over again just to talk about this test and this test. No, come at once. We're going to talk about it all. We're going to send you on your way, get the blood work, and then we'll talk about it. Telehealth, again, that's a big one. Again, and I talk about, especially for my healthcare providers, if you could provide late appointments or early appointments, right? Because again, people work during the day, just like you work during the day, people work during the day, right? So imagine most people are working at 8 to 4 and 9 to 5. Most doctors' offices are 8 to 4 and 9 to 5. When are they supposed to see the doctor? Like when are they supposed to see? Like, come on, like when are they supposed to see the doctor? Right? I don't understand doctors who do like that, right? Again, online patient portals, which I think is something that a lot of patients don't take advantage of. I think they should, right? I don't know if their healthcare providers want them to, but like online healthcare portals, if you can, like I use it all the time. I'm talking to my kids' pediatricians. I'm asking questions that like, hey, let me ask this question here, because one, I don't want to call the office and hope that they pick me up, right? I want to get to what I need to get to, right? So yeah, I understand. Time is important. Time is important for everyone. Just like time is for my healthcare providers, just like time is important for you, it's definitely more important for your patient, right? So you gotta figure out ways, right, to help maximize your patient's time so they'll come see you. Number 3, this is a big one, right? Distrust. We know about medical racism. Medicine, the foundation of medicine was built on racism. The foundation of it, right? Like we don't have to sugarcoat it. We don't have to act like that's not. Look, the foundation of medicine is built on racism, right? And as a healthcare provider, especially as a Black healthcare provider, like I have to acknowledge that, right? So I got to not only acknowledge it, right? I have to make sure that I try to build that trust with my patients, right? Big issue, especially I remember during the pandemic. A big issue was that, especially for a lot of my Black patients, right? They just didn't trust the healthcare system with this new vaccine. Oh God, where did they get this vaccine from, right? Like it was that they had sowed in mistrust, right? So a lot of my work wasn't like, praising this efficacy of the vaccine. I had to educate them that, hey, this is why the vaccine is safe. We're not trying to, this is not no science experiment, because you should have seen some of the theories that folks are coming out with when the COVID vaccine came around, right? So I had to like make sure my patients understood that like I recognize why you don't trust us. And not only do I recognize why you don't trust us, let me try to build this bridge to get you to get back on our side, right? So again, that's why it's so important having doctors who listen, cultural matches when possible. Even as I speak, right, as I record this, I think it's like blackdoctor.org or some website that focus on for patients who are looking for a Black physician is literally being sued, right, by this nonprofit. And there's a doctor on this nonprofit. Trust me. I'm going to do a Real Physician React specifically on this doctor, right? Trust in that. Because of anti-DEI efforts, which is absolutely bogus and ridiculous, right? When there's studies after studies show that having a cultural match with your provider actually leads to a more successful outcome. Plenty of studies that show this, right? But again, because we're in this DEI, anti-DEI craze, and for some reason people think DEI means Black, right? You have these people who are going after these organizations, right? So I'm going to talk about that. But again, cultural match, being an advocate, Again, being able to interview your doctor, right? A lot of things as a healthcare provider you can do to like build that trust. You're going to need to do so, right? You are not above building trust in your patients, right? Like, I don't want to hear that. Number 4, fear, right? I can end it right there. A lot of y'all are scary. Right. A lot of y'all are just scared. Right. I understand it. Right. Y'all are scared to come to the doctor. Right. Various reasons. Scared of diagnosis, scared of needles, scared of bad news. You're just scared. Right. So again, a lot of times, sometimes you need that support system. You need that accountability partner who helps push you to go to the doctor. You got to be able to understand that a lot of your fear comes from uncertainty, and your doctors are there to help provide a level of certainty for you. Right. But you got to go there. Right. You can't be on the outside, say, hey, I don't know what's going on in there, and not ask, hey, what's going on in there. Right. You got to be there. Right. Understand you can focus on what you can control. And then the last one is the system. Right. Last, number 5 is the system. Right. The system at hand is difficult. Right. It's not an easy thing. Right. These are for people who are insured, right, who can afford to go to the doctor, who have the time to go to the doctor. It may be difficult to get to that doctor. Right. It may be difficult to figure out, like, all right, which doctor is for me, right? Like, all right, I pulled up my insurance. It says all these doctors take my insurance, but then I call and they say I got to wait 2 months, 3 months. Like, hold on. Like, I just want to go see a doctor. Right. Like, it is what it is. Right. And understand that the importance of when you're going to see that doctor, like, what am I going to see the doctor for? Right. Like, your doctor may think you're just coming for a regular checkup. Like, hey, I just wanted to see, just see you. But you really wanted a preventative health visit. Right. And you got and you really wanted that testing, but they came to you and said, like, oh, this is just going to be a regular visit, and then we'll schedule you later for your annual visit. Like, no. Right. Like, again, that's a system issue. Right. Like, no, I came for my annual visit. And I'm not coming back to have another visit. Right. Just to do what we can here now. Right. So again, understand how important it is. Right. And again, I'm a big thing, right? Especially when it comes to data and owning your data, especially in this time and age where your data is so important. Right. Your data is so important. Right. You got all of these, again, these AI things that are working to try to use your data for your benefit, I hope. Right. But again, use your data to make them a whole bunch of money. Right. Like, got to own your data for sure. Online access as well too. Right. Like, I don't know when was the last time you had, like, I hate calling my pediatrician's office. One, because they're in a group. So I call the pediatrician's office, but it doesn't send me to that pediatrician's office. They have some like centralized calling station, right? So I never get to the actual office I'm trying to call to. That's why I like patient portal, right? Understand the patient portal, right? And let's knock out these myths, right? Y'all know if I ignore it, it will go away. False, right? Doctors just want to sell you pills. Yes, there may be some doctors who want to sell you pills. And you just got to do your homework to know which ones they are. But I can assure you, most doctors are trying to take care of you. Most doctors are offering you remedies that they know will do good for you, right? Like, they're not trying to sell you something. I'll go when I'm really sick. That's another one, right? I'll go when I'm really, really sick. No, that's a terrible idea, right? We want preventative care. We want you to, like, if I'm feeling a little sick, let me go. Don't wait till you're at the end, and then all of a sudden I'm gonna be like, hey man, don't come here, go to the hospital, right? Like, don't do that, right? Like, so again, tests are unnecessary, right? False. You need a test, right? You need the blood work, you need the screening exam, the colonoscopy, the mammograms, the CAT scans, you need the CBCs, the A1Cs, the blood, like, you need all of these things here, right? So there's nothing that's not necessary for you, and I can't afford it. Yeah, I don't want you to say that. Right. There's definitely plenty of options, whether it be community health, free health clinic. In fact, just do free health care near me. Right. Google it. Go into your chat bot. Hey, I need some free health care tests, free health care screenings near me. It will find it for you. Right. So that, again, that's what it is. Right. So I want to just break those myths up out the way before we end today's episode, because I think it's extremely important. Because I don't want people to keep avoiding seeing me. Right. And me, I mean the healthcare. Right. Don't come and say, you know what? Nah, I can't see them. I'll check them out later. I do not want that to be you. Right. Again, I've taken care of so many people who they wait until the end. And when you wait to the end, I have less options to wait. I have less options to treat. If I got less options to treat, that's going to be detrimental for you. Right. I don't want it to be detrimental for you. Right. So again, understand what we need to do. Right. Again, when we talk about this, your action plan for today. Your action plan for today, right? What you're going to do is you're going to identify, hey, what's causing me not to go to the doctor? And then choose the solution we talked about today. One of those five barriers that I talked about is causing you not to go see that doctor. Figure out what that is, and then figure out the solution that we talked about today. Take a small action, whether it be research, whether it be call for appointment, whether it be have a friend go with you, right? Like, you got to do what you got to do. And then book the appointment, y'all. Just book the appointment. Book the appointment, and then do your pre-homework before you get there. Have your questions written. Not just just think of it in my head, because y'all always forget it when y'all come to see us. I'm sure I can tell you the amount of people who forget what they wanted to tell me when they actually see me skyrockets, right? Like, so write it down. Just have it written on a piece of paper. Like, hey, doc, these are the 3 questions I had for you, right? Or 5 or 10, whatever, many questions, write it down. Again, we talk about getting your accountability partner, right? And then understand when that visit is over. Again, understand when the visit is over, make sure all your questions are answered. Make sure you can get some copies of your own data and your results, because I'm a big fan of that. And then get your follow-up. Get the follow-up done, right? And then celebrate. Come back to this episode. Leave a comment. Say, hey, doc, I finally made that appointment I've been avoiding for 6 months, right? Like, that's what it is, right? Because that's our goal, man. Our goal is to make sure that we do what we need to do to get to the doctor today, right? Because if we don't get to the doctor today, we're going to get to the doctor later. Let me repeat that. If you do not get to the doctor today, you will get to that doctor later. How you get there is up to you. How you get to that doctor is going to be up to you. I don't want you to get there via emergency, EMS, ambulance care. No. I want you to get there because you just did your regular visit, you did your regular follow-ups, you did what you had to do. Don't go again. Don't do it, y'all. Like, again, in my book, I talk about all these patients who, like, they wait until it's a problem. Stop waiting until it's a problem, right? Like, I already got your excuses up out of there. Stop waiting until it's a problem. Get this thing done today, right? Again, I'm yours truly, Dr. Barry Pierre, board certified internist, host of Medicine Mondays. This is why you should not be avoiding to come see us, right? Come see, go see your doctor next week, next month, whenever. Go follow up, right? And I'm gonna see you guys next week, y'all.